Hello, my name is Felix Mahfoud. I'm professor of medicine here at Saarland University Hospital. I'm working as an interventional cardiologist and hypertension expert. I was working as one of the organizing committee members for the clinical consensus statement on renal denervation by the European Society of Cardiology. The latest recommendations provided by the European Society of Cardiology were the 2018 guidelines on hypertension management. And in the meantime, a lot of data has been aggregated, including data derived from randomized sham-controlled studies indicating that renal denervation indeed is efficacious and safe in lowering blood pressure. And the clinical consensus statement was required and deemed necessary because of the data that was aggregated in the meantime. We believe it is important to provide novel recommendations on how renal denervation should be used, where it should be used, and in whom it may be applied. All what we have seen now from randomized sham-controlled studies, but also from real-world evidence, indicates that renal denervation in certain patients significantly and sustainably lowers blood pressure. We have data now out to 10 years showing that renal denervation indeed lowers blood pressure, appears to be safe. And in certain patients, it really represents a third pillar of antihypertensive treatment approaches. Besides lifestyle modification and beside antihypertensive drugs, again, some patients with uncontrolled blood pressure may benefit from a renal denervation procedure. We know that lowering blood pressure indeed correlates into improvements in outcomes. And this holds particularly true for patients with high cardiovascular risk at baseline, and particularly in patients with an elevated cardiovascular risk, patients with an hypertension-mediated organ damage, for instance. We believed that renal denervation is particularly an interesting treatment approach for these patients because we know that denervation can lower blood pressure over time, over 3 years, even over 10 years, when you look into observational data, and that then may translate into improvements in outcomes as well. We believe that the paper will inform not only the clinical community in whom renal denervation should be used, where it should be used, and how it should be used, but also to inform payers and healthcare providers about the potential impact of renal denervation and in which patient population a cost coverage is appropriate and should strongly be considered by those bodies. So I think the key takeaways refer one to the patient population that may be considered for renal denervation, which are patients on multiple medication, 3 or more, that still have an uncontrolled high blood pressure and preserved renal function. Secondly, patients who are intolerant or unable to take antihypertensive medication and express a strong preference to be treated with renal denervation or a potential patient population. The paper also discussed where renal denervation should be performed in experienced centers where not only the procedure can be done, but also where follow-up examinations are being performed, where secondary hypertension causes are excluded prior to renal denervation, and where the procedure can be done safely. So we need experienced and trained interventionalists who perform the procedure safely and efficaciously. And lastly, the paper also discusses where renal denervation may be heading to, which evidence is lacking. Novel indications are being discussed, such as atrial fibrillation, ventricular tachyarrhythmias, or heart failure, chronic kidney disease, all areas where research is pressing on and where we will see more evidence being published soon. Thank you very much for listening. Thanks for your interest in renal denervation and the topic. Research is pressing on, and if you're interested in denervation, follow up on Wonder Medical. Thanks.